On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way. Welcome to Health Her Way. I'm Brooklyn Elbert.
And I'm Meredith Cunningham, and we are back for part 2 with Dr. Mia Mowzoon. She's one of our OBGYNs at Covenant Health. Our first conversation was about fertility and getting pregnant, and now we're going to dig into her brain and her expertise and talk about what it's actually like to be pregnant and then all of the fun stuff that comes after it.
Thanks for having me.
I say fun very ironically, very sarcastically.
I learned in doing research for this episode that they call it the 4th trimester, apparently. Postpartum, yeah.
Yes. That is a thing. You're correct.
But that's for later.
Well, let's take it chronologically and start. Okay, so 2 little pink lines show up on a test. What's the very first thing a woman should do after she finds out she's pregnant?
Make sure you have insurance. I would say the first thing, because pregnancies can be expensive. Make sure you're taking prenatals. So if you don't have them already, go order them. And I usually tell people any prenatal is fine. There are brands I like better. I like Ritual. I take those. The needed ones are good. Bird and Bee are very expensive, but they're good. But honestly, anything is fine.
Anything's better than nothing.
Exactly. Just take a prenatal. If you can't take a pill, get a gummy. Again, anything's totally fine. And then make an appointment. Find a gynecologist. I would say definitely make sure they're in your insurance network. And get on that ASAP, because ideally the time to see someone is about a month to 6 weeks after you have your positive pregnancy test.
Okay.
And if you're on any last point, if you're on any medications that you're not sure about, call your primary doctor or your OB-GYN immediately and say, hey, I just found I'm pregnant. Should I be taking this or not? Right? Just kind of optimizing that. And of course, start eating healthy, avoiding alcohol, all that kind of stuff, right?
Mm-hmm.
Yeah. Live your healthiest self.
So what are those first kind of symptoms that women are going to see when they get pregnant? And obviously it's going to be different for every person, but what are some of the things that women are going to start to notice?
So I would say the most common symptoms that people have in the first trimester are nausea and breast tenderness. And that's actually how a lot of women find out they're pregnant. That can start as soon as your first day of your missed period, even a little bit before sometimes. And that's typically from a sudden rise in HCG levels, which in HCG is the pregnancy hormone, right, that we test for when we pee on a stick. So nausea and vomiting are the most common things. And I actually tell patients, always, in my opinion, less is more. Less is more in pregnancy. So less medications, more natural, right, is always better. But vitamin B6 is a great way to help with nausea in pregnancy. Ginger is also great. So there's natural things that you can do that are over the counter that you can just go get if you're having nausea. So I usually say to patients, kind of start there.
I don't know if this is good advice or not, but I used to go get a lemonade and I would sip on it so I would just get a kid-sized lemonade. I'd sip on it all day long because something about the sour tartness of it would make me not as nauseous or whatever. So I literally would just take little sips all day long, and I just survived off of lemonade for 14 weeks. But I don't know if that's actual advice, so please don't take it.
The nausea can be really hard. I usually say do whatever you can to kind of get through it, because it can be rough. It can be really rough for some patients.
So prenatal vitamins are going to be important for sure. And especially for those people who are really nauseous or are throwing up a lot. What are the best kind of foods and things for us to be eating at this first stage? And especially if you can only stomach 1 or 2 things, here are the 2 things that you should really be focusing on.
I tell patients, if you can only stomach 1 or 2 things, eat something with protein in it, right? Usually a smoothie is my best recommendation to patients. Make a protein smoothie. If you drink milk, put some protein powder in it, add some berries, sip on that the whole day. If you're really nauseous and you're really struggling, you might even want to do a powdered prenatal vitamin. I think Needed makes one of those. You can mix it into water, but at least that way you're getting your protein in, you're getting some vitamins, and you can sip on that all day. I think that's probably better than just eating carbs. So at least you're getting some nutrition for your baby, because your baby's growing your first trimester.
We often hear eat for 2. Is this a myth or is this true?
This is actually my favorite myth. Eating for 2 is not a thing. And your mother-in-law is going to love to feed you 2 servings And she is not your friend. She's not your friend. Eating fruit is completely a myth. Actually, you only need about 300 extra calories per day for your growing fetus. That's not a lot. 300 calories is like a bar or something. That's not a lot of food. Definitely increasing protein is what I typically recommend in pregnancy. Second trimester, our calcium requirements also increase. So trying to increase your calcium intake. Third trimester, definitely increasing your iron intake as well is really important. But overall, protein I typically tell patients is the most important thing that you should be eating. And decreasing sugars like sweets is also very important in pregnancy because we become a little bit more insulin resistant, which means we don't tolerate or process our sugars as well. So as lovely as ice cream and pizza sounds every night, it is not ideal for pregnancy.
You know what I think is funny is that everyone's like, I hate pickles, cannot stand them, don't even want to smell them most of the time. And everyone was like, oh, you're pregnant now, you're going to let pickles. Still did not want pickles. Like I ate like a rabbit, I definitely wanted like carrots, and I look like a little girl dinner every night. That's what my dinner plate looked like. But no pickles. But definitely I understand what you're saying about the ice cream and stuff or whatever too. I think a lot of women sometimes kind of use pregnancy as an excuse of like, oh, I can just kind of do whatever I want. But from your recommendation, it sounds like, please don't do that.
Yeah. And I tell my patients all the time, I tell them, listen, we're not eating for two. It's only 300 extra calories. Increase your protein. And there is a healthy weight gain in pregnancy, and it does depend on your starting weight. So that is a little bit different for everyone, but we're not trying to gain the most amount of weight as possible, right? Because that can actually be quite dangerous for your pregnancy, just as not gaining enough weight can be dangerous, but it is kind of a special number for everyone. So I do think just making sure you talk to your OB/GYN about how much weight you should be gaining is important.
What physical changes during pregnancy tend to surprise women the most?
So I think I get the most complaints from patients that they're so tired, but they can't sleep at night. And I don't know, maybe this happened to me, maybe it didn't. But I think that's probably, and for my close girlfriends, it was disastrous for them. And I, heard about it all the time because we're very close. But your progesterone levels increase, and that makes you sleepy, but your estrogen levels also increase, and that actually decreases your REM sleep. So you're sleeping, you want to sleep all the time, but you keep waking up at night, or you're just exhausted still the next day. And if you're someone who like tracks your sleep with a wearable device or something, and you're pregnant, you'll know your sleep is absolutely terrible when you're pregnant, and it's because of those levels. So I think that's probably what surprises people the most, is that they're just so tired, but they just keep waking up or they can't sleep. So that's typically I think the most common thing I see. Yeah.
Sounds frustrating. I love my sleep.
I know. Yeah. Pregnancy cannot be so fun.
Yeah.
Everyone. Yeah.
I will say, I think some of my girlfriends and it's so different for everybody. And
it is.
Some people get more stretch marks than others. Some people get hairier than others. Some people, I'm not kidding you or whatever. I'm sorry. Brooklyn just looked at me with the most terrified look on her face.
Acne too for everyone is so different, and pregnancy literally changes every single thing in your body.
Yeah. The good thing about it, Brooklyn, is that, have you seen my child? He's adorable, you guys. You get one of those at the end of it, so it's worth it.
Yeah.
I will say,
there's an end.
For those of you who are listening who haven't had a child yet, please do not let this episode scare you from doing so. We're just here to inform. It is very much worth it at the end. So, okay. You just kind of talked about sleep. But I think because we have such a fluctuation of hormones, it can kind of impact other things like our mood and just other, what other kind of highs and lows do we see during pregnancy because of all these elevated hormones?
Well, mood is a huge thing that's impacted, right? Like emotional lability, right? So just extreme highs and lows can happen a lot. If you already have a little bit of anxiety, it definitely get worse the third trimester specifically. There are a lot of other things happen. Your joints change in pregnancy. Your breast changes a lot, as one would expect. Your GI system slows down from high progesterone levels. So that increases constipation, and that can be really rough for a lot of patients. Pregnancy brain, you hear people talk about, is a real thing.
It's very real.
It's a real thing that it definitely is affected by your hormone levels for sure. Congestion can be something that pregnant women have from the estrogen levels as well. That can happen. And there isn't really anything we can do to help it, which is not nice. Fatigue, decreased sleeping, like you mentioned, energy. At the end of pregnancy, anxiety can kind of heighten a little bit. And that's when you can kind of get that nesting phase a little bit. But there's a lot of changes that happen in your body. And the weird thing is that it doesn't happen to everyone in terms of what they feel, right? Everyone feels a little different. And not every pregnancy is the same either. So it's a little interesting.
You know who nested like crazy was not even me. It was my husband, and he had no hormones to like blame it on. I think he was just excited and ready and doing what he thought he could do because he obviously can't carry the baby or do anything. But oh my gosh, I remember looking at him run around the house one day, and I was like, oh my God, like, is this, what am I watching? Like, he was nesting for sure. So
you just mentioned a bunch of like symptoms that women might experience, and they all sound okay. But what are some like pregnancy red flags that women should not ignore and should see their doctor for?
So I always tell patients bleeding in general at any point in pregnancy is something that they should always talk to their doctor about. So bleeding in the first trimester can be common. It can be normal. It doesn't necessarily mean anything bad is happening. But once you're in the second trimester, you really shouldn't be bleeding. So that's typically, in my opinion, the number one like red flag that should not be ignored. Something else that's really important in pregnancy, and I tell all my patients this, is movement. Like once you start feeling regular movement, you really should feel consistent movement. And fetal movement is varies for everyone. Not everyone feels exactly the same, right? But it is really important to have like consistent movement once that does start. Other things are like if you think your water breaks or having really bad cramping, my favorite thing to tell patients is good things go away and bad things stay. So if you have like a little bit of cramping in your second or third trimester and it goes away with letting you lie down or you drink some water, fine. Your body's totally changing. Imagine growing a big belly on you in a period of like 6 months. Yeah. Right? If you think of someone with like the stereotypical beer belly, that takes years to develop. And you're developing this in 6 months. So imagine all your muscles in your back and your belly are just totally changing. And that's very uncomfortable, especially if you're someone who's little. So and it can be very scary.
5'1" and no room to grow.
Yeah, right. So it can be also very scary, I think, for a lot of patients feeling those little pains and here and there. So I usually tell patients if it's something that's not bad, if you lay down, it goes away, fine, great. If it gets worse and nothing's helping it, and then you start to notice something else happens, like bleeding, like you have a little leakage or something, immediately you go to the hospital. And if you're never not sure, calling your doctor's office, usually, like I know at Covenant, we have a nurse that's on call 24/7. So they'll talk you through it on what to do because most patients don't know. And as much as I love chat, ChatGPT does not always have the right answers. So don't just rely on chat. But that's also why at Covenant, we have an OB-ED. So it's like a 24/7 ER in labor and delivery for pregnant patients only. So it's really, that's what that's meant for, right? If you are scared, don't need to wait for the next day for your doc's office to open. Call or go in.
That's great advice. Yeah. And we do have that OB-ED, and I know a lot of my friends have used it and family members, and it's been just, if anything, it's just so reassuring because even if something's not wrong, you just need to know because this tiny human's inside of you, so it's not like you can really see what's going on.
Right.
It's very stressful.
100%. Exactly. And the nice thing about that too is it's run by OB-GYNs. It's not like ER doctors, which ER doctors are amazing, but they'll even tell you, pregnancy is like not their number one skill. So it's nice to have an OB-GYN see you there, which is great.
Well, you just said it about congestion. There's so many medicines that I think a doctor would normally be like, oh, you're congested, here's that medicine. But while you're pregnant, you can't have that. And so that's why you guys are the experts in knowing what you can and can't do and should and shouldn't do.
And I actually give all my patients a list when they first come in for their first visit of all the safe over-the-counter medications for pregnancy for different things. Because that's, I think, a big issue, right?
Oh, yeah.
Everything you Google, ChatGPT or Google, it says, consult with your doctor before taking every single thing. Literally. It's probably good.
Okay, so you bring up a really good point. I mean, we still try to like live our lives when we're pregnant, but you can't do anything. No Botox, people. No laser hair removal. No, none of the fun things that you did. You cannot go on roller coasters. That was a really probably silly question I asked my OB-GYN. Can I go on this roller coaster? No. Yeah. So, but everything says consult your doctor. So can you explain why a lot of these things maybe aren't dangerous, but like we're never going to test pregnant ladies and be like, oh yeah, we'll figure out if that's safe or not. Totally. So
I mean, some things are kind of like common sense, like
the roller coasters.
Yeah, like roller coasters, right? Like that sounds dangerous. Like horseback riding and skiing probably are not great because the fall risk is so high, right? Things like Botox, is it dangerous in pregnancy? Actually, they just came out with a study for patients with migraines who do Botox for migraines, and they actually recommended it as an option. But I tell patients, listen, it's 9 months of your life. You can live without Botox for 9 months.
You will not be that wrinkly after. It's fine.
Yes, like 9 months you could live without your Botox. I mean, it's a hard ask. It's a hard ask, but you can do it, right? So it's just kind of like being as healthy as possible, if that makes sense. Trying to think of other things that are.
There's like a million things I felt like.
But I think we've talked about that before, and you can have some coffee,
yes,
right?
Yeah, you can have 1 cup. I used to tell people it's the size of like a grande at Starbucks. 1 cup of coffee a day is totally fine.
We talked about kind of the initial visit right after women find out they're pregnant. Can you kind of walk us through what some of the appointments and screenings look like throughout each trimester?
Yeah, so typically that first visit after you find out you're pregnant, obviously, like I said, we're doing all this stuff like optimizing your health, medications, everything like that. We usually do an ultrasound between 8 and 12 weeks to verify that you are pregnant, that your pregnancy is inside your uterus, and how far along you are. And then we do first trimester labs at that visit typically. So we're checking for things like immunity to the measles, to make sure you're immune to measles and chickenpox. We're checking your blood type. We're checking your hemoglobin level to make sure you're not iron deficient. And then we're also talking to you about screening for like chromosomal anomalies. We can screen for things like Down syndrome. We can do that typically anytime after 10 weeks, depending on the patient. So that's something that we do. And that's done with a blood test. And that's also how a lot of patients will find out the gender early. And that's typically around that time, which is kind of exciting for patients, especially if you want to do like a gender reveal. And then other, I guess, important appointments would be at your 20-week visit. Typically is when you do an anatomy scan. And your anatomy scan is looking at your baby and making sure all the anatomy looks good. So 10 fingers, 10 toes, that's typically how I describe it to patients, making sure the heart looks good. I always say that's kind of like the last check mark to make sure that your pregnancy is healthy. And then after that, we're screening for other things like gestational diabetes and screening for iron deficiency anemia and other infections. And then just making sure that your blood pressure is good and the heart rate's good. And there are no warning signs or any symptoms that are concerning that we need to be alerted or do other tests to find out what's going on.
I like to be transparent on this episode, on this podcast. The glucose test is not that bad, people. I feel like you hear a lot of things like, ew, it's so gross.
The other day.
It is not that bad, okay? It is not a big deal. Now, the thing I didn't know about towards 37, 38 weeks, there's a strep B test. That one's a little more invasive and not as comfortable. I didn't know what that was. So can you explain and freak Brooklyn out and tell us what that test, what is it? How is it performed? But also what is the obviously importance of it?
Right. So at 36 weeks, typically we do a swab of your vaginal area, and it is to screen for something called group B strep. So it is a type of bacteria. It likes to live on our skin, mostly in pregnant women is when we find it. We have bacteria all over our body, right? All of our skin, we have normal flora, and that's normal, how it should be. But it increases, the group B strep bacteria increases on our vaginal area when we're pregnant. And this wouldn't be a problem, except in babies, after babies are born, it can cause very invasive disease. So the group B strep that we find on the vaginal area, if it's present during delivery and women are not given antibiotics to treat it at delivery, it can cause the babies to get very sick. It's rare, but it's not rare if it's you, right? So that's why it's important to screen for it.
Okay.
Yeah.
I was going to ask how common it was, but you answered that already.
It's rare for the babies to get sick from it, but it's pretty common to have group B strep.
Oh, okay.
It is pretty common.
So to finish up with kind of pregnancy, obviously delivery is something that we've all seen in movie and TVs and stuff like that. And some people make it look a little more beautiful and euphoric, and some people make it look a little more terrifying. I feel like for every woman, it's probably somewhere in the middle of all of those things. But one way that we can be a little more prepared is with a birth plan. So can you either talk about, are those helpful or not, and what should really be on those?
Absolutely. So I think something that's really good about birth plans is it helps educate you on what your options are during delivery and kind of what to expect. I typically tell patients it's great to have a birth plan. I provide patients with a template if that's something that they want. But again, it's more about preparing for birth. Like, what options do I have? Do I have to get an epidural? Is an epidural helpful? Are there other pain options other than epidurals, right? Because there are. And it's good to be educated on all of these options. And then what does labor look like? Am I going to be stuck in a bed? Can I walk around the room? Am I going to have an IV? Why is an IV important? Which it is important. But, and that, I think even making that birth plan gives you the opportunity to talk these options with your doctor, right? What medications are they going to give my baby when I deliver? Are these medications necessary? Why are they important, right? And it gives you the opportunity to talk it through. I've had a lot of patients who come in with one birth plan and then they leave with another one because I'm like, well, let's talk about this together. And then it also gives me an opportunity to know what's really important to you, right? Like what from this is really important to you that you want me to try to focus on? You know, if it's your husband cutting the cord, or is it you being present during delivery, right? Like what is actually important to you? Because I think it also helps us focus on like the fine tuning of it too. And then the last thing about the birth plan I always say is it is a birth preference list, right? It is what you want to happen. But I think the most important thing about making a birth plan is knowing that it does not always go to plan. It is labor. I'm not in charge. You are not in charge. Your baby's in charge, right? and that's the fun of it too. Labor and delivery is one of the best fields to be in. And that's why I love being an obstetrician, is because everything is different, right? It's always different. Everyone's different. No one's birth is ever the same. It's always different. And just being prepared for the unexpected. So yes, this is what we want to happen, but knowing that it may not happen, right? And what are our goals? Our goals are always have like a healthy baby and for mom to be healthy. But also I think explaining to patients what's going on, why we're doing certain things is very reasonable, right? And that's also, I think, where social media can be a little bit helpful and harmful, because there's a lot of horror stories on social media about births that can be really scary. And I think some people do have like this amazing birth, but I will tell you, the patients that have an amazing birth are the ones that have realistic expectations. Like,
Yeah.
right? I mean, then that's just like, I think also part of life is really being educated on like what things are going to happen and what it's going to look like. And if you go into birth to thinking everything is going to be perfect and exactly going to plan, and you're not going to have a good experience because it's just, you're not going to be prepared.
This might be the one time not being a planner is good for me.
Yeah. And sometimes patients, I think it's, if they are super planners and they like making that whole plan, I don't think it's necessarily harmful. I just think that it's something that needs to be done like with your OB and talking through it. And like, again, being okay if it doesn't work out.
As a type A person with OCD who took every class under the sun, read every book under the sun, had my birth plan printed out, ready to go, it did not go that way. The one thing I wrote on there that I didn't want to happen was the one thing that ended up happening, because it was the best way. At one point, he wouldn't come out. You know, the dang thing just decided he was comfy and was cool, chilling there forever. So anyways, I will say I trusted my doctor. She explained to me, because I will tell you, my sweet husband, I think the second she suggested the thing that I didn't want to happen, his eyes went as wide as saucers, because he was like, oh God, that's the one thing she said she didn't want. But I will say, same thing. We asked her, okay, like, why is this the best plan moving forward? Like, where are we stuck and how's it going? And then we trusted her and everything went great and it was fine and it was okay. I think a lot of it is like the fear of unknown.
100%. The fear of the unknown with being pregnant, delivery, like most importantly, I think, is the worst. And that's why it's usually hardest for first-time moms, because you just don't know what to expect.
Right.
That is how I would feel. I get it. I'm always scared of the unknown. It's very reasonable, right? And I agree with you. Having an OB that you trust to make the right decisions and help you make the right decisions is really important, because, you know, at some point you do, and this is why I tell patients too, at some point you do need to trust your OBGYN. So if I have a patient who I feel like doesn't trust me, or I always tell them, listen, you need to trust me, or you know, find someone you do trust, because I'm an OBGYN for a reason, right? If I go to a gastroenterologist, I'm not going to tell them how I want my colonoscopy or something.
Right.
Like, I don't know anything about I could definitely not my area. Or like my dentist, like I don't know about teeth, right? So I always say like it's really important to find someone you trust, have a good plan in place, and trust them if it deviates from that.
I have a really unhealthy attachment to my OBGYN. I love her tremendously.
Most people do, which is not a bad thing. I just moved a couple months ago. Like I still talk to so many of my patients from when I was in Scottsdale, and I miss them.
Yeah.
Well, it's arguably one of the biggest, most important days of your entire life. And you're there to help us kind of like go through
Very
it.
vulnerable too.
Yes.
Yeah,
Yeah.
totally.
Oh, you think like I was telling you the strep B test or whatever, the group B test is invasive. Wait till you have a baby and there's 40 people in the room staring at you and you're like, oh, hi, everybody. This is such an interesting angle to meet you at. All right. Okay. So pregnancy, a little wild, but what I think is even more wild, no joke, is the 4th trimester, is the postpartum. Because you're navigating, physically recovering from something. So I think whether a C-section or vaginal birth is taxing on the body alone. And then here's this tiny human being that you need to keep alive. And especially for a first-time mom, you're trying to figure out how does this baby latch? What does a breastfeeding mean? And all this kind of stuff. So talk about some of the biggest kind of like maybe issues that pop up for your patients in those couple of weeks right after birth.
Yeah. So, I mean, I think, so postpartum period, like the 4th trimester, is rough on everyone. And I think having that expectation going into it is the most important thing, because it is not easy. You have a complete sudden drop of all of your hormones. Anxiety can get worse. Postpartum blues are very common. Postpartum depression can appear. Physically recovering well. Feeding your baby, if you're breastfeeding, is difficult. I think for almost everyone, it's not as easy as it may seem. And I think that's something that people just understand as they go through it. But it does take some work sometimes. I think some of the changes that like people don't expect to linger as long is, one is like losing the baby weight can take a long time. And I think that that's something that a lot of people don't really realize. I think also mood. It can take a while for your mood to be normal. You know, postpartum depression, you know, we say, I don't know the exact number on this, but typically like 6 months, it can really last for, or it can appear within that time. And that takes some time, right? Your body is going to change when you deliver, and it may not go back to how it was before you had a baby, right? Your body goes through so many changes that it takes time for your body to adjust. So just being patient with yourself too, and knowing that that's normal. It's normal for your body to change. It's normal for your body not to look and feel like you were 2 years before you had a baby. So I think having resources is really important. I know there's lactation specialists at Covenant, which is really helpful to help moms with breastfeeding. Reaching out to peers around you is really important. Having a good support system. I mean, I always call my patients about 2 weeks after they deliver and check in on them and make sure, you know, their mood's okay and they're feeling okay. Because it can be a hard time for a lot of people. And I think it's just totally made worse by no sleep, right? It's not easy.
Well, I think there's this expectation too that like, oh, you have this newborn bliss or whatever. And so everything's supposed to be rosy and rainbows and sunshine. And I
think that doesn't exist.
It does not exist. No. And so I think we're harder on ourselves because we think it should be a certain way and it's not always that way. But one of the things I think too that no one warned me about was, ladies, get a donut or something to sit on afterwards because you will not be able to function for a while. And I think that was one of those things that all my girlfriends who had babies, like one of them called me like 3 days later. She's like, can you sit yet? I'm like, wait, you knew this was going to be a problem? Why didn't you say anything beforehand? So what is it? I mean, it felt like someone took a bat to my vagina, basically, after I had a baby.
I mean, your hips are literally completely changing. Your entire pelvis is changing to fit a baby through, right? So like it is a big alteration of your body. Tearing below, like if you have vaginal birth, or on top if you have a C-section, both are very hard to recover from, right? I mean, everything takes a while to recover and to go back to normal. So I just think being prepared for that is all you can do.
Listen, take home everything from the hospital, by the way. They give you all this wonderful stuff.
They give you everything. And, you know, you can go to Target and it's so expensive, all this stuff that they give you everything at the hospital to take home with you.
Yeah, you take home that peri bottle, you take home those lady diapers, whatever you need.
Put it out in the freezer. I tell patients, like all the stuff. But it's not easy. It's not easy. And I think having expectations that it's not going to be easy is the best way to like set yourself up for success. And reaching out when you need help, you know, talking to someone.
Something else I did before I had the baby was I pre-made a bunch of like freezer meals and stuff that I like. So I didn't have to worry about it like afterwards. And I will say that helped tremendously. I also told my mom that I did not need her
Yeah.
I think that after the first
agree with that. Yeah.
after the first night, I definitely called her and I'm like, hi. And she said, my bag's already in the car. I'm like, okay, well, great. Come on. Because she lived in Dallas, so a couple hours away. But I think it's one of those things. I'm a very independent person, so I don't like to ask for help. And so I think that's one of those expectations we probably need to set again, which I think is like the biggest part of the conversation here, whether it's preconception, pregnancy, postpartum. Temper your expectations.
100%. It is not, although some people may have the easiest time ever and it's just amazing and this perfect dream, for most people, it's not like that. And I think, I totally agree with you. Tempering your expectations is like the best way to set yourself up for success. And then, listen, think about your resources ahead of time. Who can you reach out to? And if you don't know where your resources are, ask your OB-GYN, ask one of your girlfriends, ask around. Because I think that preparing for things to not be great is like the best way to set yourself up for success.
I do want to ask a very important question about postpartum in the fact that you're not spot-free or scot-free like after you pop out that baby. There are still some things. They talk about blood pressure and like fevers and different things. Like what are some complications that, like Brooklyn said earlier, some things are going to be normal, like bleeding for a couple of days, but like, oh no, this is a red flag. We need to come see you or to the OB-ED.
If you have a very bad headache after you deliver, I would say you go to the OB-ED. If that happens like within the first couple of weeks after you deliver, really maybe even like within the first 2 months. If you had a history of high blood pressure and you take your blood pressure at home and it's high, or if you didn't have a high history of high blood pressure and you have a headache, you take your blood pressure at home, it's high, you go to the OB-ED or call your OB/GYN, right? Those are two very important things. If you all of a sudden have chest pain, trouble breathing, go to OB-ED. Or if you all of a sudden start bleeding like crazy and you're, soaking pads, go get evaluated. These are things that can happen. In the world, hemorrhage is one of the most common causes of maternal death. Not in America because we know how to treat it, right? But in the world and with places with low resources. So those are things to be aware of. And typically the nurses are really good about telling you, hey, these are things to look out for while you're at home. That would prompt you to seek urgent evaluation.
Well, thank you so much for joining us today. I know I learned a lot.
I learned a lot too.
Yeah. Good. No, this was awesome. Thank you so much for having me.
Of course.
It's great. Always out to talk about pregnancy stuff.
Don't worry, we will have you back soon.
Yes, great.
Yeah, you're stuck with us now.
Yeah. Love it.
Thank you all for listening to this episode of Health Her Way. If you enjoyed the conversation, be sure to follow the podcast wherever you listen and share it with a friend.
If you have questions or topics you'd like us to cover, connect with us on Instagram or Facebook at Covenant Health, and we'll see you next time. This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.